Today I'm going to be performing ostomy care. So the first thing I'm going to do is I'm going to verify my physician's order, and I have already gathered all of my equipment, and then I'm going to identify my patient. Joe Russell, date of birth 11/26/1950, and we will also get him to verbalize that. So next step, what we're going to do is we are going to perform hand hygiene, and we're going to don clean gloves. So we're going to perform hand hygiene and then don clean gloves. Alright, and then now we are going to expose our patient while maintaining privacy. So first thing we want to do is we're going to want to empty the pouch. So we're going to take a graduated cylinder, and we're going to open the pouch at the bottom and empty into the cylinder. So once that has been emptied, we will dispose of the contents, and if we need to measure the gastric output, then we would be able to measure it, and then we would dispose of it in its corrected place, such as like just a bathroom toilet. All right, now we are going to remove the ostomy bag. We're going to carefully pull away from the skin. All right, and then we are going to dispose of this in the biohazard bag. All right, now we are going to clean the skin, but first we're going to assess the skin, look for any irritation, notice the color of the stoma, or any abnormalities that can be noted at this time. So now we are going to clean. We are going to use warm water. So I'm going to take a gauze, and then we are just going to wipe around the area. Now we're going to dispose in the container. We'll wipe again. Okay. And then we are going to pat dry. Okay, now that the area is clean, we can remove our gloves, and we are going to perform hand hygiene again. And now we are going to don clean gloves. And we've only removed those gloves if they were visibly soiled. So now we are going to prepare the new ostomy bag. So our first goal now is to measure our stoma. So we are going to take our measuring tool. We're going to measure the stoma. Okay, that's perfect. So now we are going to take our exact measurement and take our new ostomy bag, and we're going to place it over. And then we will trace it with a marker. All right. And then now we are going to cut. Be careful not to trimming the actual bag itself. All right, now that our bag is trimmed, we will just go back and cut any sharp edges that could interfere with the stoma or irritate it. We want it to be as smooth as possible. Okay, so now that we have it cut, we're going to peel off the adhesive layer, and then we are going to place it over the stoma. Okay, and then we are going to apply some pressure around to ensure the seal has been unlocked and that it is tight and it won't be moving anywhere. So now that we have it placed, we're going to close up the end of the ostomy bag. So we're going to go this way. All right, and now that it has been put on, we are going to cover our patient again. We'll discard of all of our equipment, remove our clean gloves, remove our gloves, dispose of them. We're going to perform hand hygiene. We're going to document procedure, any observations noted, any of the gastric contents, and anything else that seems abnormal.